right, hey Nashville, thanks for tuning in. We've been given some specific questions, actually questions from some readers and people who've been following us on social media have had some very specific questions about liposuction, tummy tuck, a few other topics. We're going to do our best to get through these. So thanks again for tuning in and we'll get right to it. And liposuction is a procedure where we directly remove fat. It's a great tool for removing fat and it does it very, very well. A lot of people don't realize this, but we're born with a fixed number of fat cells. Sometimes people have a misunderstanding about this and they think fat cells are like skin cells or cells elsewhere in the body that multiply and replicate. And that's what happens when you get fat. But that is not true. We're here to dispel that myth. Fat cells are just storage containers for fat. And they get bigger or smaller depending on what your caloric intake and expenditure is. And so you're born with a fixed number. People who have liposuction, we take a tube that has, we call it a cannula, and it has a little hole on the end of it. And with some suction applied, it directly removes fat. And we can put our cannula in a very specific location to be very specific about how we remove that fat. As a tool for fat removal, it's a great tool. It's tried and true, and there have been many variations on it, but it's been around for a long time. Unfortunately, it does have some limitations in the sense that it doesn't tighten skin. It doesn't rearrange or realign or tighten muscles. So there are some limitations with what we can do with liposuction. It depends. It depends on what area we're treating with liposuction. So with liposuction, I treat all manner of areas from the fat underneath the chin to arms, thighs, tummies, flanks, etc. We even do ankles, or what are commonly called cankles, folks who have fat around their ankles or lower leg and are unhappy with the appearance. So in general, 6 to 8 weeks is the answer. Ankles are the slowest to resolve after liposuction, and the swelling sometimes hangs around there for 10 or 12 weeks. Of course, we use compression garments in each of these cases. If it is ankles that stay swollen a long time, we use compression socks. The trunk, meaning the tummy, and the flanks are probably the most commonly areas treated with liposuction. Swelling stays there for about 6 weeks, and compression garments for that area involves an abdominal binder, which is an elastic binder with a Velcro fastener. Liposuction versus a tummy tuck is the question. What is the difference? So that's really a good question. And liposuction, as I mentioned earlier, is a great tool for removing fat. There's a tube, which we call a cannula. It's got a hole on the end of it, and we place that underneath the skin to directly remove fat. It only addresses fat, and again, that's a limitation of this procedure. When folks come in and they're interested in a tummy tuck, usually they have problems with 3 different things. They have some fat, they have skin excess, or they have or they have muscle laxity, which is a diastasis. Your 6-pack muscles, which run straight up and down your abdomen, starting from just underneath the rib cage all the way down to the pubic bone, can get pulled apart. And that can happen from obesity, for being heavy. Most commonly it happens from carrying a baby to term. So the space in between these muscles, when it gets stretched out, is called a diastasis. And you can do sit-ups all day long, and you can do abdominal workouts to get your muscle tone back, but you cannot close a diastasis. A diastasis will not correct with exercise or any other measures other than surgery. So an abdominoplasty, or tummy tuck as we call it, is a procedure where we get rid of some of the extra skin, we get rid of some of the extra fat on the tummy, and we also tighten those muscles. There are variations on this, such as a mini tummy tuck, where we typically don't do muscle work if folks don't need that. There are other variations on it, which I won't go into for simplicity of this video, but I almost always use liposuction when I do an abdominoplasty. And I use it on most of my body contouring cases to transition the areas where we've done a surgical procedure to the adjacent area where we have not. So a good example of this is a tummy tuck. We might have a nice flat tummy, but for folks who come in, we might have a nice flat tummy after a tummy tuck, but for folks who come in and have extra fat on their side or flanks, love handles as they're called, we don't want to leave that. We want the whole trunk to appear nice and natural and anatomic. So what we'll often do is use liposuction with the tummy tuck to transition these areas on the side so that everything looks normal and natural and anatomic, as we say. Example, I think that you see results based on the anatomic area when the swelling goes out. So for the trunk, which is tummy, flanks, you start to see results at 4 weeks, but final results you see between 6 and 8 weeks. Other areas like the submental area, that's the area where we do liposuction on the neck, you see the results even faster, like 2 to 4 weeks. Final results at 6 weeks. Ankles are the slowest. We tend to see final results 10 to 12 weeks later. All right, guys. Well, short list of questions. Appreciate you asking them. And as long as you keep asking them, we'll keep answering them. Thanks for tuning in. We'll see you next time. Check us out on www.robinsplasticsurgery.com. Thanks.